You wake up one morning with a razor-sharp pain slicing through your throat. Every swallow feels like glass. You think? Just another winter sore throat. But what if this time it isn't? Imagine a COVID-19 variant, so notorious for its excruciating throat pain that doctors have nicknamed it the razor blade throat strain. Sound dramatic? Not. Thousands around the world have reported a sore throat so severe it's nearly impossible to eat, drink, or even talk. But here's the twist. It doesn't always come with the usual COVID warning signs. No fever, no cough. Sometimes just that one terrifying symptom. So, what exactly is this razor blade throat COVID variant? Why does it hurt so much? And how is it different from previous strains? Most importantly, how do you know if your sore throat is just a regular bug? Or if you should be more concerned? What is the disease? How does it progress? Let's break it down. COVID-19 has been mutating since the pandemic began, giving rise to variants with unique symptoms. The razor blade throat nickname isn't official, but it's become shorthand for a recent variant that seems to target the throat and tonsils with near-surgical precision. Think of your throat as the grand entrance to your body, a hallway lined with security guards. Normally, viruses sneak in quietly. But with this variant, the attack is fast and focused. The virus invades the throat's delicate lining, causing intense inflammation, swelling, and pain. Instead of spreading aggressively to your lungs, like the original COVID strain, this variant seems to camp out in the throat. Over the next few days, the pain can grow sharper, sometimes leading to swollen glands, trouble swallowing, or even losing your voice. For some, that's as far as it goes. For others, the classic COVID symptoms follow: fever, fatigue, and congestion. But the key difference? The throat pain hits first, and it hits hard. Symptoms: early warning signs. So, how can you tell if you've caught the razor blade throat COVID variant? Let's break down the timeline. Early signs: sudden, severe, sore throat, described as raw, burning. Or like swallowing knives, difficulty swallowing, talking, or even breathing, swollen tonsils. Sometimes with white patches, swollen lymph nodes under the jaw or in the neck. Advanced signs: low-grade fever. Chills, fatigue, or muscle aches, headache, or ear pain radiating from the throat, voice changes, hoarseness. Or even total voice loss. Lab and diagnostic clues: rapid antigen or PCR tests for COVID-19. Positive throat swab may show redness, swelling, or pus. Blood tests: mild elevation in white blood cells. Have you had a sore throat so painful it made you skip meals or avoid talking altogether? Do you feel like your throat symptoms are far worse than any cold or flu you've had before? If so, you're not alone. And it's worth considering a COVID test, even if your other symptoms are mild or absent. Root causes and mechanisms. Why does this variant target the throat so aggressively? Viruses evolve to survive. The razor blade throat strain carries subtle mutations in its spike protein, making it especially well suited to latch onto receptors found in the upper airway and throat tissue. Unlike earlier COVID variants, which targeted the lungs, this strain seems to prefer the warm, moist lining of the pharynx and tonsils. Some scientists believe the immune response in these tissues is different, leading to a dramatic release of inflammatory chemicals that cause pain and swelling. Lifestyle factors play a role too. Our modern lives, indoor heating, air pollution, dry air, and even talking loudly in crowded places can weaken the throat's natural defenses. Plus, stress and lack of sleep can make our immune system slower to respond. Mythbuster: it's not just bad luck or weak immunity. Even healthy young adults are reporting this symptom. The variant simply has a new preferred target. Dangers if left untreated. Here's the scary part: most people recover, but ignoring severe throat pain can be dangerous. If left unchecked, the inflammation can cause abscesses in the tonsils, dehydration from not drinking enough fluids, or even breathing difficulties if swelling blocks your airway. And though this variant is less likely to cause severe lung problems, it can still trigger complications, especially in people with weakened immune systems, chronic illness, or those who delay seeking help. Long COVID is also a risk. Some patients report lingering throat pain, voice changes, or difficulty swallowing for weeks or months after recovery. Remember, just because your chest is clear doesn't mean you're safe. The virus can do real damage upstairs quietly and quickly. Prevention tips. So, how do you protect yourself and loved ones? 3 things to avoid. Crowded, poorly ventilated spaces, especially during surges. Ignoring a severe sore throat, get tested early. Sharing drinks, utensils, or close face-to-face contact. If you or someone else has symptoms, 3 things to do. Keep your throat moist, drink water regularly. Use a humidifier in dry environments. Practice good hand and respiratory hygiene, wash hands. Cover coughs, mask up when needed. Rest your voice, whispering or shouting can worsen throat inflammation. And don't forget, stay up to date on COVID vaccinations and boosters, which can reduce the risk of severe illness even with new variants. Treatment options. What should you do if you catch the razor blade throat COVID variant? At-home care, hydrate. Sip warm teas, broths, or electrolyte drinks to soothe and prevent dehydration. Use throat lozenges, saltwater gargles, or honey to relieve pain. Rest your voice and body. Avoid talking, singing, or shouting. Over-the-counter painkillers can help manage pain and fever. When to seek medical help. If you have trouble breathing, swallowing, or severe swelling, persistent high fever, confusion or dehydration if symptoms worsen after a few days instead of improving, medical treatments. Antiviral medications may be prescribed for higher-risk patients in rare cases, steroids or antibiotics. Hospital support for severe cases, natural supports, warm herbal teas, humidified air to ease dryness and pain. Gentle nutrition, smoothies, soups, soft foods. Always consult a healthcare professional before starting any new medication or supplement, especially if you have other health conditions. Here's what matters. A sore throat may seem harmless until it isn't. The razor blade throat COVID variant is a reminder that viruses are always adapting and we need to stay alert. Listen to your body. Don't dismiss new or severe symptoms even if they aren't what you expect from COVID. Early testing and care can make all the difference. And remember, most people recover fully, especially with prompt attention. You have more power than you think over your health, your habits, and your healing. Stay curious, stay cautious, and above all, take care of your throat. Your voice matters.